Good morning, everyone. My name is Pravina Gautam, and this is my student ID. Today, I'll be presenting on the comprehensive nursing assessment and management of a patient named Mrs. Teresa Milo. She's a 68-year-old lady who is diagnosed with embolic stroke. In this presentation, I'll discuss her A2A assessment for nursing high priority nursing intervention and 3 medication used in her care. First, I'd like to give a short overview about embolic stroke. Embolic stroke is the condition in which a blood clot or other debris is formed in another part of the body, most frequently in the heart, and then move through the bloodstream to the brain, where it gets stuck in the cerebral artery and block blood flow to the certain part of the brain. As we know that it reduces the oxygen and nutrient to in brain cell, which causes embolic stroke and neuronal death unless it is addressed rapidly. So early intervention, recognition, prompt assessment, and evidence-based nursing management is important to improve patient condition and prevent complication. While caring Mrs. Milo, uh, we need to do A2E assessment. When caring a patient with acute stroke, a systemic A2E assessment is essential. It is the best way to detect and treat clinical deterioration in embolic stroke. Mrs. Milo has low level of consciousness, TCS 12 out of 15, slurry speech, and left-sided weakness, which is consistent with embolic stroke, secondary to atrial fibrillation. Her vital signs indicate respiratory rate 26 bpm, SpO2 95%, heart rate 136 beats per minute, BP 180 by 98 mm of Hg. Now, I'd like to discuss A2 assessment in detail. Here, the airway of Mrs. Milo is patent, and oxygen is used 6 liters per minute through Hertz and Max. Nevertheless, low consciousness indicate her airway obstruction and aspiration. Nurses should be careful about airway obstruction and have suction and airway device ready. In this case, she should be placed on the semi-fowler position to ensure airway remain open and decrease the chance of aspiration. Green et al. Indicate that the stroke patients who are conscious enough must undergo a closed airway examination to avoid secondary brain injury caused by hypoxia. European Stroke Organization also advised to keep oxygen saturation at a greater than 94% to maximize cerebral oxygenation. Now, while assessing her breathing, we can see her respiratory rate is 26 beats per minute with the shallow breathe and oxygen saturation 95%. This result suggests that there is slight respiratory distress, which may be because of decrease in neurological control of breathing. So the nurses are advised to persist with oxygenation monitor. Respiratory distress and arterial blood gas is recommended when her saturation is low. Oxygen perfusion of the brain should not be reduced to less than 95% to minimize ischemic injury. In case of low respiratory rate, they should call rapid response team immediately. Now let's have a look on circulation. Her heart rate is 136 beats per minute and blood pressure is 180 by 98 mm of Hg, and capillary refill is less than 3 seconds, which are the sign of atrial fibrillation and hypotension. If atrial fibrillation is not controlled, it can promote the development of clot, which causes embolic incident. Arrhythmias should be detected by continuous ECG monitoring. Blood pressure should be managed, but excessive reduction may decrease the cerebral perfusion, whereas uncontrolled hypertension creates risks of intracerebral hemorrhage. The Australian Stroke Foundation recommend maintaining systolic blood pressure at a minimum of 185 mm of Hg, then thrombolysis will occur. And as per the case, to maintain her hydration, intravenous Hartmann solution 20 ml per liter should be continued. Now let's have a look on disability. While talking about this disability, we can discuss her GCS is 12 out of 15 and she has slurry speech left-sided impairment which indicate neurological impairment. Every neurological observation should be performed to check the progression. Hua et al. Also state that NEWS2 with GCS score can better predict mortality in stroke. Now, Mrs. Milo is affable while talking about this exposure. She has no wound or bleeding, maintaining normal temperature and prevention of pressure injury are critical nursing role. To avoid other complications, the skin assessment, repositioning, monitoring of the fluid balance is very important. Fever raises the metabolic condition of the brain and aggravate neurological performance. Hence, temperature control, skin integrity, as well as infection prevention is essential feature of exposure assessment. Now let's go to the neurological observation and early sign score. These are the high priority nursing intervention. At first, I would like to discuss about prevent aspiration and maintain airway safety. We can see Mrs. Milo has low consciousness and dyspepsia, so she is at high risk of aspiration pneumonia. Nurses must perform a swallowing and cough reflex assessment before any oral intake, maintain nil by mouth, and keep her in a semi-fowler position. As we know that impaired gag and cough reflex can cause silent aspiration. Early assessment reduce pulmonary complication and ensure safe nutrition as well. The next one is monitor and manage blood pressure and cardiac rhythm. In her case, nurses should monitor ECG and blood pressure to reduce the risk of atrial fibrillation and hypertension. Systolic blood pressure should be maintained below 185 mm of Hg before thrombolysis. So blood pressure should be within the range in maintenance of cerebral perfusion and in inhibition of hemorrhagic conversion of ischemic stroke. Early diagnosis of arrhythmias enable the management of disease in time by pharmacology or electrical therapy to minimize the chance of repeat embolic stroke. And the third one is prepare for thrombolytic therapy and coordinate with stroke team. After CT scan proved the presence of ischemic stroke, IV antiplase preparation must be done in time. Nurses are also sure that no contraindication to it. Recent surgery, active bleeding, and abnormal coagulation profile exist. With the help of the stroke team, thrombolysis can be provided within the 4.5 hours after the onset of symptoms. By using this interdisciplinary practice, they can get better outcome and meet global stroke management guideline as well. And the other one is maintain cerebral perfusion and oxygenation. Adequate oxygen and head positioning determine cerebral perfusion. Mrs. Milo was kept in semi-fowler position with the head midline to prompt venous drainage. As I already mentioned, that oxygen therapy at 6 liters per minute maintain oxygen through Harson max. Saturation above 95%. In her case, avoiding neck flexion or rotation prevent compromised cerebral venous return. Continuous monitoring confirm early detection of any respiratory compromise or neurological deterioration as well. Now is the turn for medication. Medication used in Mrs. Milo case are Ateflez IV. It is a thrombolytic agent that dissolves clot to restore blood flow. It must be administered within 4.5 hours after stroke onset once hemorrhage is excluded. As we know that nursing responsibility includes checking INR less than 7, monitoring for sign of bleeding, discontinuing infusion if hemorrhage occur. Some of the side effects include hypertension and bleeding as well. Safe and timely administration significantly improve neurological outcome here. And the second one is heparin infusion. It prevents clot propagation and secondary embolism. The activated partial thromboplastin time should be maintained between 60 to 80 seconds. And the nurses must monitor any bruising or bleeding. 2 nurses should double check before infusion and pressure should be applied after IV removal to prevent bleeding. Heparin therapy complement thrombolytic treatment and support cerebral perfusion balance as well. And the other one is metoprolol 50 mg. PD. It is a beta blocker which control heart rate in atrial fibrillation and help to stabilize blood pressure. Before administration, we should monitor heart rate and blood pressure and need to withhold the medication if heart rate is below 60 beats per minute or systolic blood pressure is below 100 mm of Hg. I just want to discuss some of the side effects which include bradycardia and hypotension. Regular monitoring ensure therapeutic effectiveness while preventing the adverse effect as well. Now, in conclusion, I just want to say that the A2E assessment framework provided a systematic approach to identify life-threatening condition in Mrs. Milo's case. Evidence-based nursing interventions such as airway protection, blood pressure, and cardiac monitoring and thrombolytic preparation were essential in preventing complication and improving recovery outcomes. Safe medication administration combined with multidisciplinary collaboration ensure quality care and alignment with Australian Stroke Foundation and European Stroke Organization guideline. And this is like my references. Thank you for listening to me.